Hi, this is Brian Decker with your Market Minute. We talked about the will and the power of attorney. Now let's talk about the living will or healthcare directive. This is the pull the plug document. Three important things. One is succession. If you're married, that's easy. Primary is your spouse. Secondary should be competent children. Again, if you've got someone with medical background, make that an easy choice. But if you don't and you have two children, consider having them co-secondary agent acting in your behalf so that they're working together to help mom and dad. So that's succession. Make sure that there is comfort measures. Half of the healthcare directives we look at don't have that. Make sure that you've got pain medication in there. Quote, even if it hastens my death. You want to make sure that you don't suffer. We're all over DNRs. We're all over no artificial hydration and nutrition. Well, you're going to suffer unless you have comfort measures. The last thing is the activation or trigger clause for the healthcare directive. If you have a healthcare directive and it states that it's active when you no longer recognize someone, or it's active when you've been diagnosed with a terminal illness, that is step one. That's half of it. So yes, that activates your healthcare directive. But for your children's sake, make sure that you add this. In our opinion, this is going to be very important so that your children don't live with the guilt that they think they killed mom and dad by pulling the plug. Add the language and the content that says, quote, when two doctors determine that I'm kept alive artificially, I would like to have them end my life. So something like that, so that two doctors come to your children and say that mom and dad are kept alive artificially. They didn't want to live that way according to your healthcare directive. And now they don't live with that guilt. We've seen that. So hopefully that's helpful.